This was a new family, and both children looked unkempt with soiled clothes. Their father was defensive when I asked him how they had been feeling.
The physical exam for the boy was unremarkable, but he wouldn't look at me and was shaking and tearful. He wouldn't talk, but also didn't want to leave the exam room.
At first, I thought the little girl was fine. The initial exam didn't reveal anything obvious. But x-rays showed a previous injury that had not healed well, which is why she felt so much pain. I had to talk to her parents about it.
The parents requested medication for ADHD because their son had been getting in trouble in school. But the boy didn't have any symptoms of ADHD when I met him. He seemed scared to me, and no one could explain the bruising under his shirt. I needed to consult about his well-being at home.
The safety of children is the primary responsibility of every pediatrician, primary care physician, or medical provider who works with children. There are many types of abuse or neglect, and it's important to look for associated signs that may have occurred. These include physical abuse is any intentional injury of a child by hitting, punching, kicking, shaking, or other harmful action. Signs include unexplained bruises, burns, or black eyes. If a child shrinks from the approach of adults, or if he or she resists returning to caregivers, providers should consider these warning signs of possible abuse. Neglect or abandonment is the failure of a caregiver to provide for a child's basic needs, which include shelter, supervision, medical care, education, or emotional needs. Be aware of school absences, hunger, lack of immunization history, dirty skin, body odor, or insufficient clothing for the weather. Sexual abuse occurs when any person fondles, penetrates, or exploits a child's body in any manner. Be aware of this possibility if a child has difficulty walking or sitting, reports bedwetting, demonstrates age-inappropriate knowledge of sexual behavior, or is reluctant to disrobe in appropriate circumstances, like during a physical exam or when changing for gym class at school. Emotional abuse includes constant criticism, threats, rejection, or withholding love or support. Some signs of emotional abuse include extreme behavior problems, like passivity or aggression, lack of a close relationship with a parent or caregiver, or suicide attempts at a very young age. Substance abuse by adults has a specific impact on children. Prenatal exposure to substances can cause significant medical problems for infants. Producing, selling, or distributing narcotics in the presence of a child, or providing any alcohol or drugs to a child are considered child abuse. Every medical professional should seek specific, thorough education on child abuse and neglect, as well as on signs, symptoms, and warning signs for each distinct type. Know all state-mandated reporting requirements. Ensure reporting and crisis lines are easily available in your work environment. Consult with colleagues and fellow professionals as often as necessary. Remember that if any type of child abuse or neglect is suspected, it is not the responsibility of the medical professional to prove the behavior. Rather, your mandate is to report the potential abuse or neglect to the proper state-based agency. It is the responsibility of that institution to investigate and respond. The care of children who may have experienced abuse or neglect should be considered an urgent matter that requires immediate action. The safety of the most vulnerable patients is your top priority. Your patients deserve nothing less.